Hello, good morning, everyone. No, it's not even morning. See, I messed it up. Anyway, we have an unusual time for our coffee morning today. It's 2 o'clock in Singapore, and we've got the lovely Maggie with us. Maggie is the owner of First Aid Tuition, and she'll give us a little introduction herself just to tell us what she's doing, what the company is all about, what their offerings are. And then we'll dive into a presentation that for today we wanted to make all about choking and gagging and so on, and what is the difference and how do we handle it, because this comes up in our solids workshops all the time. It comes up in the mummy groups all the time. So a super important topic for you to learn about. But if you have any other questions regarding first aid, we're super happy to take those as well, or Maggie is rather than. So pop them in the chat and I will pick them up and ask Maggie for you and she will respond. Maggie, welcome. Thank you for sharing your afternoon with us.
Yeah, thank you. And yes, I'm really glad to be here. So yeah, thank you for inviting me. So yes, my name is Maggie. I am the owner of First Aid Tuition. I'm a nurse by profession. So I'm from the UK. I've been in Singapore for quite a long time, actually, for 15 years, I think now.
Oh.
And in those 15 years, I've been working as a nurse, but also in other different clinical roles. So now I find myself doing first aid, which is fantastic, and I very much enjoy doing it. And partly because I'm a mum as well with young children, so I really understand the importance of first aid. And as a professional, I can tell you that working in, I have a background in acute medicine, and working in accident emergency and places like that, you do deal with obviously people that have had first aid. And as a professional, I can tell you that when people have had small little actions taken of first aid, that really improves the outcome of that patient dramatically. So really from a professional and from a personal perspective, I'm really keen to share what I can today with first aid.
That is amazing. Yeah, because all of a sudden being pushed in the role of motherhood and then not knowing what to do in a crisis, and crises will come. Hopefully no, dramatic ones, but definitely you will have your fair share of accidents and so on, and knowing how to handle them is great. Okay, Maggie, I'll let you share your presentation. You've prepared a lot of content for us, which is great.
Okay. Let me go ahead and just do that just now.
For anybody who's joined in the meantime, if you have questions that pertain to the slide we're looking at, please pop your questions in the chat. Later on, there might be an opportunity for you to speak directly to Maggie too.
All right. Okay. I take it you can see my slides okay?
Yes.
Amazing. Okay. So let us begin. So just as you said, Joanna, this is an introduction to first aid. The focus is on choking, but if questions come up and just in generally about first aid, very happy to take those. If it pertains to what we're discussing at a time, more than happy to be interrupted during the presentation, or if it's something separate that you just quite like to have a chat about, we can do that at the end as well. Okay.
Perfect.
Okay. 1 second. Oh, I'm having some difficulty moving my slide on.
It worked just earlier.
It did. It worked a second ago, but it's telling me it doesn't like doing it right now. Let me just stop sharing and I will try and reshare.
Try it again. No worries. Thank you for all the mummies and daddies joining us today. We're super happy to see you here. And thank you for being so accommodating with a change in time as well. Yeah, we're back on.
That's it now. I don't know why it blocked out there, but it did. Anyway, we're moving now. That's good. So just a little bit about First Aid Tuition. So we've been around for 15 years. And so hopefully I'd like to think we have a good proven track record of providing good quality education. One thing that's a little bit different about us is that we're all nurses. So not only are we qualified first aid instructors, but we actually are nurses as well. And with that, we have to have first aid and general medical up-to-date knowledge. We customize our training for your needs. So that means that we do even our public courses, we always ask people that come along to our courses, what is it that you're looking to find out today in particular? What's an area of concern for you? How old are the people in the household? So that we can make sure that we tailor the training towards your needs, and so that it makes it a little bit more kind of real for you as well. And our focus, which hopefully you'll see today, is about teaching the why we do things. So we like to explain why is it you take a certain action rather than just do it. we hope that with that approach that maybe there's more chance that you're going to remember those really important steps if you do need to use them in the future.
Mm-hmm. And I'll jump in right there for those people who maybe are tailing off and so on. Maggie actually offers, or First Aid Tuition actually offers, if the fact that if you can get a group together of like 5 moms and you want to learn together in the comfort of your own home even, then they're able to facilitate that, and they can they're giving us a discount as well for that. So do make sure you reach out to Maggie and see how you can make that happen, so you can do it at a time that is convenient for you and, without having to travel too far as well. So
yeah, definitely. And you can do that just to reach out to make it easy for you. You can reach us through our Instagram account, or you can just send us a WhatsApp message. There'll be a QR link to our website at the end of the presentation. You can just get a connection to WhatsApp just straight there to send us a message. Okay, let us continue then. So the focus, as I mentioned a moment ago, is first aid for choking today. A little bit of a morbid statistic to talk about first, but I think it's an important one. So when we talk specifically about children and choking, deaths arising from accidental choking are usually occurring in children under the age of 5, with the majority of those deaths really affecting children who are less than 2 years of age. Really important to understand that this really is an at-risk group, but now we can move on to figure out what is it we need to do to try and reduce those risks. So we must first of all understand the danger. So why is it that children are more at risk of choking? Well, first of all, they have smaller airways, very small airways, which we'll come to just shortly. Also, they're developing their chewing and swallowing skills. So they have to learn these skills. And through that whole learning process, of course, that they are naturally going to have a cough or a choke while they figure out how to move food around in their mouth. And they do lack molars. So the molars are the teeth at the back of your mouth, which are the ones that kind of can mash food up and macerate food a little bit more for you. Young children are predominantly biting using teeth at the front of the mouth, and that ability to mash up food a little bit more, difficult to eat food, so things like with fruits with skins and things may be more difficult for them. Exploring through the mouth is obviously a very natural thing for children to do. That's how they learn about the world. So they have a higher tendency to put things in their mouths. And also they are more prone to distraction, unfortunately, as well. And have immature reflexes. So when we say reflexes, what we're actually talking about here is a cough reflex. So of course they can cough, but that cough may not be as powerful as an adult cough.
Distraction during eating also applies to teenagers, I'll have you know, but
yes, very true, very true. So I want to talk now about the anatomy of swallowing. So I think it's important to understand what's actually going on, in your throat, just so you can figure out what actually happens when you choke. So figure 1, you can see here, we have some arrows which are showing air coming into the nose, also could be coming in through the mouth and coming down the back of the throat. Now you can see that there are 2 tubes here. So you have one tube at the front, which is called your trachea. You don't have to remember that. You can also call it the windpipe. That's what people often do refer to it as. So you can feel it on yourself, just at the front of your throat. You do have kind of areas, kind of rings of cartilage, which come around this tube at the front here, and this is coming into your lungs. Now, at the back of that tube is the tube that comes down into your stomach. So that's your esophagus. So this is the tube which you can just see here. Now, the interesting thing about these tubes is that when you swallow, your body's so clever, it actually closes off the tube to your airway. So this says your epiglottis. Again, you don't have to worry about names, but just basically have this little valve that comes down as you swallow, and it covers the entrance into your trachea, which goes into your lungs, to allow the food to pass safely down into the stomach. So when we're choking, what's actually happened is something has gone into this part of your airway here. And now the response that your body has to that is to tighten some muscles and try and force that object back out. Okay, so just important just to understand, what is actually happening when we swallow. So let's talk about the airway size in children. So this is in millimeters, the size of airways. So for neonates, which is the age from 0 to 6 months, is 3 to 3.5 millimeters. For infants, which are 6 months to 1 year, it's 3.5 to 4 millimeters, and then infants it was your age from 1 to 2 years, is 4 to 4.5 millimeters. So this is roughly about the size of the diameter of a straw. So I have a straw here. And I did check the diameter of this very straw just to fact check, and it is actually 0.5. So yeah, 5 millimeters. So this is true. I guess it's a good reference as to how large is the airway. Now, when we say airway, what we're actually talking about is the trachea. So that picture you saw earlier, it's this portion here that comes down and into the lungs. Of course, the throat is slightly larger, but I think it's good to focus on what is the smallest point of the airway. And so when we're thinking about food and things, it's you want to obviously protect your child's airway, so we're interested in the smallest point. So going on now to talk about choking. So you have two different types of choking. You have what we call a mild airway obstruction, and we have a complete airway obstruction. Really, really important to understand those two things, because you manage these two types of choking completely differently. So let's deep dive into that a little bit more. So with a mild airway obstruction, what we're actually talking about is somebody who's quite noisy. So they're coughing. And if someone's coughing and they're making a noise, that means that there's air passing through their airways, passing through their vocal cords to allow them to make a noise. So if air is passing through, then they can breathe. And quite often their faces become red. They could possibly be distressed as well. I mean, we've all had instances of coughing and choking quite badly for various reasons. So it's not a comfortable experience. So somebody, particularly a child, may well be distressed, but the point is they're making a noise. If they're making a noise, they're breathing. So they're not in any immediate danger. So again, this is just what we spoke about a moment ago, is something has come into the trachea here, and now the person is trying to get that out. So they have this involuntary reaction of this clenching of the muscles around this area here to try and expel that object out. So what do you do in this situation? The most important thing to do is to stay calm. Encourage coughing and provide lots of reassurance. Be really mindful when we're talking about small children that they are looking to you and your facial expressions to see what danger they are in. So if you're panicked and worried about this choking that they're doing, and if this is something that you're going to threaten their life, it's quite possible that you could have a look of great worry on your face. That could then translate to your child reading that they're in serious danger, and then that could then make them panic all the more. If they're panicking, it's more difficult for them to clear their airway. So it's really, really important to try and perfect that poker face and just give them that reassurance. You're fine, you're okay. And what you mustn't do, which I know people are very tempted to do, is to perform back blows.
Oh, or the back blow, okay.
Yeah, the back blows, yeah. Oh, sorry, I didn't catch what you said, Joanna.
I was going to say stick the finger in and try and catch it, but that's also not a good idea.
Yeah, you mustn't do that either.
No, exactly.
But we'll come to that. We'll come to that.
Yeah.
So I just want to just highlight the back blows, because this is something that quite often I notice when we teach first aid. Quite often people are quite surprised about this, and they're actually I guess surprised that they shouldn't be doing such a thing, because that's something that they thought was a natural thing to do. And I'm sure we've all had it done to us as well, that people have come behind us when we've had a bit of a cough and then whacked us on the back. What can happen when you do that is, just imagine you have that object sitting somewhere, just the entrance into the lungs. We know it's a mild airway obstruction because they're making a noise, they're coughing, so there is air coming in and out of their body. Now, you hit them on the back. So as you hit them in the back, you cause a vibration. With that vibration, what can then happen is that object that was sitting maybe at such an angle which was not completely blocking the airway now moves. And it moves in such a way that actually it now completely blocks the airway. So that's why it's really, really important, as much as we may want to hit somebody on the back when they're coughing, that it's really important not to do so. But what you can do, because I know maybe you want to do something, maybe it's a good idea, rub them on the back. Just give some reassurance, it's okay, keep coughing, you're okay. And even lean them forward a little bit just to help them, get that object out of their mouth. But try not to do this. This is not a good idea. In this particular situation, and a mild airway obstruction, when they're able to breathe, don't perform back blows. Now you can, if they have a complete airway obstruction, which we'll come to just in a moment. Okay, so now let's talk about a complete airway obstruction. So when someone has a complete airway obstruction, often they are silent, or they may have a very weak cough. So when I say a weak cough, it's not it's a very, very quiet, a cough which is ineffective. So because the cough is ineffective, that means that we have to take some action. But typically, there's no cough. If someone's not coughing, they're not making a noise, it means there's no airway coming in and out of their trachea. It means there's no air passing through the vocal cords, which is why they're silent. Quite often you'll see their facial expression. Well, obviously they'll be panicked, but also the colour around their face will change as well. They could go a shade of grey, shade of blue. You may see some blue around their lips. Quite often, and what is recognised as a universal sign for choking, is to put your hands around your throat. This is something that people naturally do when they are choking. However, with young infants, they actually don't often do that. They do something called flailing arms. So when I say flailing arms, what I mean, and you see my little mannequin here, they put their arms like this. So they do this motion, okay, rather than bring their hands up to the throat. But certainly they will be communicating to you that they are uncomfortable, they are frightened, and of course they will feel quite panicked. So this is, I think it's important to keep showing this slide, because I really want you to understand what's going on when you choke. So what's now happened is food has come into this area here, but now it's big enough to actually completely obstruct the trachea, this area here. So now there is no air coming in and out, which is why obviously they're in distress. So what do you do? And this is the important bit. So for children under the age of 1, we do something a little bit different to a child over the age of 1. So for under the age of 1, we perform back slaps. Now remember, this is back slaps in a situation where someone has a complete airway obstruction. So it's totally appropriate to do these back slaps or back blows in this situation. Now you can see from the picture, what we're actually doing is the head is down. So that means that from a gravity perspective, because the head is down, and you're hitting on the back, you cause a vibration, but because the gravity now, hopefully, the food particle or whatever happens to be in the throat will come out. So what you do, the first thing that you do is to hold the child, if you can, like this. So you're almost creating like a sandwich. So you're supporting the jaw with your hand like this, and the back of the head with your hand like that. Now, this is a nice light mannequin. But I think it's important to say that depending on the size you are, and depending on the size your child is, which obviously is quite variable in that first year, then this may not be an easy maneuver to do. If it's a difficult thing to do, then even holding the child just like this, you want to try and support them and hold them in such a way as that you can bring them forward. That's the aim, that's the maneuver you're trying to perform right now. And just remember as well that sometimes when we're doing first aid training classes, people are like, things are really hard, and it takes a lot of power, I don't have that power. You have this amazing chemical in your body, adrenaline, which is released in times of panic. Now, of course, this would be a time of panic, so you will have this amazing strength. So although it seems that absolutely impossible to do this, thinking about maybe the weight of your child, in times where you need to, it's amazing where that strength comes from. Okay, so back to the actual maneuver. So holding your child like this, the first thing you want to do is to bring them forward and down. Now, what you're actually doing, I'm just going to try and angle myself so you can see. You actually want to make sure your forearm is supporting the child across their chest and holding their jaw. And then you want to have the head down. Now, we can do this standing up, but if your child is, a bit heavy, or you just feel that you need a little bit more support, you can do this having one leg outstretched. And so if I were to do this, just showing the camera, my leg is outstretched, I can now rest the child onto my leg, which gives me a bit extra support. Now, when you're in that position, you want to go between the shoulder blades. I'm just going to show you that position right now. Yeah.
Maggie, sorry to interrupt, but would you mind stopping your sharing, the screen sharing?
Sure.
Because then people who watch this at a later stage in the recording will get a better view of how exactly to position the baby.
Oh, you're quite right. I was going to do that, but I forgot.
Sorry, so
let me do that just now. And we're going to come back and do this a couple of times because I want to give everyone on the call, even if I don't see you, I want to give you the opportunity to actually, if you do have a doll, a teddy bear, or something around you, you can actually do this with me. I don't suggest you actually do it in your child though. That's probably not such a good idea. Okay, so holding at this, then bringing the child. I'm going to move my arm so I can do it this way. Your child forward, so you're now resting on the forearm. If you can manage it, and I'm just going to angle it, if you can manage it so you have the child in such a way that they're resting on your forearm and they have a leg on either side, it just makes it more stable. And then you can have them resting on your legs so you can sit down, or you can do it this way if you feel you're strong enough to do so. Now, between the shoulder blades, this part here, this in the center, you want to get the heel of your hand, and then the heel of your hand should be hitting just here between the shoulder blades and very firmly. So I'm just going to do that for you now. So 1, 2, 3, 4, 5. Okay, so nice and firmly. Then what you want to do is support the back of the head, but keep the head down. This is important not to be tempted to do this, because just imagine there were some food bolus or something which stuck in the throat. You struck the child 5 times to give them the back blow, and now you've loosened that bit of food, and then next thing you do is bring them up like this. It may cause that food to go back down. So just keep them in this way, head remains down, and this is where you use your other hand to now bring the child over. So now it's your other forehand, which is now at the back, on the child's back. You're supporting the head if you can manage to do so. And now the next movement is going to be a chest thrust. That means 2 fingers between the nipples. So the nipple line is here. You can see just below the nipple line, 2 fingers here. Now, what's important to remember is when you press here, what you should feel is bones. You should feel the sternum. If you maybe place your fingers a little bit too low down, you're actually going to be in this area where it's a bit soft in the tummy. You don't want to press this area. So you definitely want to make sure that your fingers are just below the nipple line, and when you're pressing, it feels firm, it feels hard. It's your sternum bone that you're actually pressing on, not on soft tummy tissue. Then you're going to press 5 times. So 1, 2, 3, 4, 5. And then at this point, what's really important is to check to see, did something dislodge and come out? So you're going to take a look inside the child's mouth. If you can see something, and you can actually get hold of it with your finger, or pop your little finger in and sweep it out, then you can proceed to do so. If you can't see it very well, or you can see maybe something way at the back of their mouth, don't be tempted to try and dig it out. What you can do in that situation is potentially push it back. So try and look to see if anything's in there. If you can see it, take it out. If you can't, just leave it alone, okay? And then what you do is, again, hand over the child, turning them around, and then 5 back blows. This is something that you should continue until hopefully the object comes out. You have a few minutes to do that. If you're unable to clear the child's airway in a few minutes, they may become floppy and unresponsive. The next step at that stage would be to perform CPR. So that's cardiopulmonary resuscitation. That's not something that we're going to go through today, but it's just to let you know that that would be the next step, okay? I'm going to pause now. I'm going to go through just those steps again, just one more time, and give people opportunity if they want to follow, with their own, teddy bear or doll, they can do. But I just wanted to see, does anyone have any questions about what I've just said just now?
We've had quite a few join us, so feel free at any point, if you have any questions, to pop them in the chat, and I will pick them up and ask Maggie those questions. If there are any now, please drop them in there. Otherwise, we're going to repeat the sequence. Yeah, very good explanation. I thought so too. But yeah, it doesn't hurt to see it again, and maybe to practice, as Maggie was saying, on your own props at home. Not your child, your props.
Not your child. Okay, let me just share again. Okay. So yes, back to this presentation. Now we're just going to go to a slightly more abbreviated slide. So if somebody wants to or if you all as a group want to join and have a go at doing these steps, I'm just going to run through them again and do them with you. So just remember, if you can, you hold your child this way, supporting the back of their head, supporting their jaw. And just imagine you're holding them like a sandwich. And what's really important, even if you can't have your arms this full length of the child even to hold your child this way is okay. What's important is you have the ability to do this. Oh, is that a question? Maybe not. Okay, maybe just some feedback. You have the ability to switch from side to side like this. So this is the point of your hands to be able to allow you to pivot. So just remember, the first step is the back blows. So bringing your arm on the down, so it's on the force on your forearm is supporting the child. If you can reach their jaw, then you can do that. If you cannot and you're holding them this way, this is also okay. The point is make sure the child's head remains down. But a lot of the time when we actually are doing the training, and it just sense check for yourselves if you're doing this in the background, that a lot of people, they actually are doing this. So it's really, really important. I can't emphasize enough. Remember, head down. You want gravity to help you here. So center of the back here between the shoulder blades, heel the hand very firmly. 1, 2, 3, 4, 5. Then we're going to use our forearm and put our on underneath and the second arm now on top, and then we're going to do this pivot. So now we've turned the child the other way around. We're managing to support them with our forearm, and now we're going to do the chest thrust. So remember, nipple line is guidance. Draw a line between the nipples, just below the nipples, 2 fingers, and now you're going to do 5 chest compressions. So 1, 2, 3, 4, 5. Then we must remember to check. So we check to see, is there anything inside the mouth? If we can see it and we can reach it without digging in too much, then we can pull it out. If we cannot, just continue doing what you're doing, which means you're going to put your forearm back onto the child again. If you can reach their chin, then do so. If it's just the chest, that's okay. And again, you're going to do that slight pivot round and then start your back slaps again. Okay? Hopefully that is clear. It's kind of hard to do that on the camera. So much used to doing it in person. But really, really important steps. Key thing, keep the head down. And if your child is heavy, you're struggling to do it in such a, I guess, it's very easy to do this in a mannequin, but on a child, it's a bit heavier, it may be difficult. So just remember, the key is head down, back blows between the shoulder blades, and then chest compressions just below the nipple line. Always 5, doesn't change. Keep going until you get that object out. And of course, if you don't and the child becomes unresponsive and floppy, next step is CPR. Okay, let's move on. So this is for children under the age of 1. So what do you do if your child is 1 year and over? So now we're going to have to do what we call an abdominal thrust. So other people might know it as the Heimlich maneuver, but this is classically what you're doing is an abdominal thrust.
Maggie, do we want to share again? Sorry, stop again so we can see you better.
Yes. Yeah, thank you.
I know it's difficult. It's easy to forget.
Yeah. Okay. So yes, coming off the sharing, so we can now show you how you do an abdominal thrust. So this is now a child mannequin we have here. The key thing to remember before you do the abdominal thrust is you have to adjust your height to the person you're doing this to. So if you have a child who is like 2 years old, it's not such a good idea to stand behind them your full height and then for you to now try and, holding over them like this and doing this sort of movement. This is not the correct thing. What you want to do is you want to have your belly button about the same level as their belly button. So it means when you do the abdominal thrust, it means you're going to be at the correct angle. If you're towering over somebody, you're not going to be at quite the right angle to perform a good abdominal thrust. So it's really important, if it's a child, get onto your knees, so you're now kneeling next to them and behind them to perform the abdominal thrust. Now, before we go on to show you a bit more about the abdominal thrust, I want to explain to you what it is you're doing. So this is our mannequin's tummy. Now we have this big muscle at the bottom here, which is called your diaphragm muscle. So your diaphragm muscle is what helps you breathe. So as you inhale and exhale, your diaphragm muscle moves up and down. Now we know, because we have a complete airway obstruction, that there's something here in the trachea, the windpipe, which is blocking the airway, which is stopping somebody allowing air to come in and out of their lungs. So there is still air inside here that's trapped. So we're going to use that air which is trapped inside the lungs to try and force this object out that's here. So what we're actually trying to do in the abdominal thrust is trying to get under the diaphragm muscle and push up to force the air which is in the lungs out and force the object which is in your trachea out. So when you see, if you think of Mrs. Doubtfire, if you watch that movie, and they do abdominal thrust in the movie, and literally you do see the food come flying out. It really is what happens because we're trying to force using the air which is left in the lungs to force the object out. So it's just a good idea to try and understand what is it you're trying to do when you're thrusting on someone's stomach. To help you remember, it's really important to have the right technique, because what you're trying to do is get the air in the lungs to force the object out. So now let me take you a little bit further into the details of the abdominal thrust. And we have to make sure we get our hand position correct. And we're going to use the belly button as a landmark. So find the person's belly button, and then you're going to clench your fist. Now you clench your fist, doesn't matter right or left, doesn't make any difference. You're going to put the thumb, pop it in, and then wrap your fingers around like this. And then this part of the hand, you want to bring just above the belly button. So you're going to do it in such a way, if you find the belly button, it's approximately around about 2 fingers diameter above the belly button. You want to pop the hand. Then you want to bring the second hand on top, which is going to give you a little bit more force. And then in that movement, I'm going to pop the mannequin down so you can see a little bit better. So the movement you're actually going for is you're not going to try and do this straight back. You're not doing scooping either. What you're trying to do is like a diagonal motion like this. So almost like an angle. So if your hand is here, you're trying to angle back this way to try and get under the diaphragm to push the air out. Mm-hmm. So back on the mannequin again, finding that belly button, hand above the belly button, second hand on top, and you're doing this angling this way to try and get this air out of the lungs. Okay, I see there's a question there. Is that something you want to address now?
The question is for mild airway obstruction for 1 year, for 1 year and older. The direction is also not to act on it. Sorry, meaning mild obstruction, the Heimlich maneuver or the thrusting, we only do when there is a complete obstruction, when they're silent and not coughing. Sorry, I've got something.
Yeah. Yeah, it is ironic you start coughing. Yeah. No, let me take over. So yeah, if I understood the question correctly, is that when it comes to a mild airway obstruction, we basically encourage the person to clear their own airway and not to intervene. In that situation, you're providing assurance to try and help the child, cough and clear the airway. They have a cough reflex, so they're able to clear their own airway. When we do an abdominal thrust, or we're doing back blows, but specifically we're talking about abdominal thrust, what you're actually doing is you're almost creating a synthetic cough. So you are coming under the diaphragm muscle to kind of simulate a cough, to try and force that air out. So this is only appropriate when there's a complete airway obstruction. So there's a complete airway obstruction. We do want to do the abdominal thrust to force this air out via the trachea and whichever object is stuck there out of the mouth. Okay.
Amazing, good to know. The thing that I always remember is silent and blue. They need help from you, and loud and let them go.
Red, let them go ahead. Yeah, which is a good rhyme. Sometimes people who are silent and blue, so silent and blue being that they have a complete airway obstruction, but sometimes they can also be a bit kind of red and flustered. So
Singapore.
Yes, that's true. Yes, but basically, yeah, that rhyme, or just to think about, if somebody is making a noise, they can only make a noise if there's air passing through their vocal cords. Air can only pass through their vocal cords if they're breathing. So if they're making a noise, they're okay. They may be uncomfortable and quite stressed, but they're okay. If they're not making a noise, or if they have a really, really weak, very quiet cough, then they're in trouble. And that's when you absolutely need to intervene. Okay?
Amazing.
Okay, let me come back to the...
Sorry, yeah. Got something else there. My 5-month-old gags when he drinks every single time. We tried different feeding positions and paced feeding. He still gags, coughs, and sometimes his face turns red. He's usually fine after 20 seconds. May I know what's the best way to deal with this situation?
Can I park that one just for now, because we have some slides on gagging.
Okay.
So let's come back to that. Fantastic question. Thank you for raising it. Let's come back to it. Okay. Now let's go back to the presentation. Okay. Now just to add, so we've talked about the abdominal thrust. So we know the action. The thing just to add in here, I know the focus for today's talk is children, but I think it's worth saying that abdominal thrusts can be performed in anyone from the age of 1 above. So that obviously means adults, but not to perform this on a pregnant lady. Obviously, if you do this to an abdominal area of the lady who's carrying a child, you're at risk of damaging the child. So you wouldn't want to do that. Instead, you'd want to do a chest thrust. And actually, let me just stop sharing again for a moment. Sorry, I realized that I probably want to show you this better. So when we talk about a chest thrust, what we're actually doing is similar to what we did with the infant, with using the 2 fingers to do the chest compression. We're going to do something very similar, but using our hand. So it's the same fist position which I showed you for the abdominal thrust. So the thumb tucked in, fingers wrapped over, and using the inner aspect of your hand, you're now going to place that into the center of the chest. Now, what you can do to get a good landmark is just imagine you're coming behind somebody who's pregnant, who's having some difficulty. You need to now do what we call a chest thrust. You come underneath their armpits. And if you come underneath someone's armpits, then naturally you'll arrive at the center of their chest. Now you're going to bring your hand to the center of the chest, second hand on top. And now the movement is directly back in this situation. So when we talked earlier, we were talking about abdominal thrust. We're trying to get under the diaphragm. So we need to make sure there's an angle when we're pulling back. When you're actually giving somebody a chest thrust, you're actually going to be the center of the chest. You're just coming straight back. So don't try and do any angling. It's just straight back, just to try and help somebody who's pregnant. You could also use this with somebody who's maybe not pregnant, but maybe your arms are shorter than the diameter of their tummy. So you have some difficulty getting round in front of them. There's a possibility you may well be able to actually give them a chest thrust instead.
Mm-hmm. Okay. I've got a question for you here, because that comes up often, is can I do any damage doing this? Like breaking a bone, or, breaking the sternum, or breaking a rib? What is the danger of it? And is it still puncturing a lung? I don't even want to think about that. You know what I mean? But how?
No. Yeah. It's a relevant question. We talk just later on the slide. I have a couple of slides just so we talk about contraindications. So it's more focused on abdominal thrusts as opposed to chest thrusts. With chest thrusts, it's unlikely that you will do damage. Now, that's not to say that you wouldn't do damage. And I'll give you a similar answer to what I'd give to somebody when we teach CPR. Quite often people say, now CPR is a little bit different, because remember, you're using your full body weight to press into someone's chest. So you're not using the same amount of force. So that's why I say it is unlikely. Yeah. However, you can never say that something like that wouldn't happen. You could have people that may be predisposed to having more fragile bones. You could be dealing with an elderly person who have naturally more brittle bones. You just never know. The way that I would view it is follow the techniques I've shown. Unlikely you're going to hear a crack or do any damage. If you do, at that moment in time, that person's life's in danger. They're not breathing. So if you're able to do anything to dislodge that, even if it involves a crack to the rib, it's better that you've dislodged that than not. Also, I won't go into any more than that. I think I may cause complications if I talk any broader. Okay. So I think it's a valid concern. It's unlikely, and where you're pressing is the sternum area as opposed to lower down, where your ribs are not necessarily connected to the bone in the middle, and so it's less likely that you're gonna cause a fracture, and it's not the same as CPR. You're not applying as much force. Yeah, I get that. All right. Thank you. Okay, let me continue. Let's find this presentation again. Okay, and again, just as we said before, that if somebody does become unresponsive, so if somebody's standing, you're trying to do abdominal thrust or chest thrust, then you might find them become very heavy and fall to the ground. What we do suggest, if you remember to do so when you're doing abdominal thrust or a chest thrust in somebody, is if you're able to, a child who's small, it's not such a concern because you can hold them and help them to the ground, but an adult, especially we were talking just a moment ago about pregnant ladies, to pop your leg in between their legs so that if they do collapse, then they can fall to your leg and you can help them down onto the ground. Just an added thing to think about, you may not remember, but it's just a little bit of nugget of information to add in. Okay, now let's move on. I want to talk to you about back blows. Now, some countries don't necessarily talk about doing back blows in a situation where you have a complete airway obstruction. Usually they just stop at the abdominal thrust, but it is a recognised way to assist as well. And it's a question that I often get when we train. Depending on, we train a very international group of people, so depending on which country they come from, they do often ask this question. So I'm mindful that there might be people on the call today that have heard of back blows in situations where there's a complete airway obstruction. So I want to address that and I want to talk to it. So absolutely, giving back blows is something that you can do. It's exactly the same as what we showed you with the infant, as in the positioning of the hand is the same, using the heel of the hand, it remains the same, but obviously the position of the person's body is a little bit different. So let me just stop sharing it again for a second. So now what you can do is you can bring your arm in front of the person. So now you're almost kind of giving them that additional bit of support, and then encourage them to lean forward. So you have your hand in the front of the chest, coming across their chest, asking them to lean forward, and then in between their and the mid part of their back, in between the shoulder blades, again, it's the 5 back blows. And what you can see in the picture on the slides, so just like put those slides back up again, that there is an option for a younger child that you can pop that child onto your lap. Let me just bring these slides up. So you can have this position with the child. So having them on your lap, and then their head, if you can manage it, their head down. Again, it's to get gravity to help. So you have an older person, an adult, less likely you can get them. You're not going to put them on your lap. it might be difficult to get them, so far forward. But definitely that angling forward is best. But if you have a toddler, then you can have them on your lap, and then maybe even with their head down, just to help gravity and remove whatever is sitting in their trachea. And the 5 back blows. And what you can do then, if that doesn't work, go back to the abdominal thrusts. What I would say is that universally in all countries, I haven't actually come across a country which doesn't advocate this, they do say abdominal thrusts. So abdominal thrust is your priority. But if you've done 5 abdominal thrusts and you can't manage to get that object moved, then next thing you can do is now you can do 5 back blows. And then just as that you did with the infant, so you just alternate. So 5 abdominal thrusts, 5 back blows, and just keep going back and forth in the hope that one of those movements is going to help remove the obstruction there. So they work in slightly different ways. Obviously, your abdominal thrust is trying to force the air out, whereas your back blow is using some vibration to try and remove the object from where it is. Okay. Now, I'm aware I've given quite a bit of information, so I'm just going to kind of pause here for a second and just ask if anyone has any specific questions around what I've just shared.
Any questions there, Mami? Studies?
Okay.
No. Okay.
Okay. All right. So let me continue. And again, just the last thing to say, of course, if you don't manage to remove the object, just the same as what we talked about with an infant under 1 year, then they would, of course, go floppy or start to fall towards the ground, and then you would help them to the ground and then start CPR. So let's move on. So contraindications. So we did mention just a moment ago when we were asked about, potentially, can you do any damage in relation to chest thrust? When we talk about abdominal thrust, we are a little bit concerned because your abdomen, of course, is a soft area, and you have your livers just here at the top of your abdomen. So you are performing putting some pressure in an area where we know we have some organs. So if somebody has, after you've delivered an abdominal thrust, some pain or discomfort around their tummy, or just generally feeling unwell, they should definitely go to urgent care and be assessed. Also, after a choking incident, if somebody feels that they still have something in their throat, maybe they have a persistent cough or some difficulty in swallowing, it's also important for them to be seen at urgent care too. It could just be localized tissue damage, which is giving that sensation, but there is the possibility as well that maybe there's still something there or something that's gone into the chest. So you absolutely, definitely want to have them checked out. Okay, so let's talk about the gag reflex. So this is a very common question that we get because there is some confusion sometimes around gagging and choking. And, is it the same or is it different? But it's different. So your gag reflex is a natural protective reflex. So it's your body's trying to expel something back into your mouth. And it's actually, it's almost the reverse of swallowing, is a way that you could explain it. So with swallowing, your body is guiding food down and into your stomach, but with the gag reflex, which is happening at the upper part of your mouth or your gastrointestinal tract, it's trying to force the object forward and out. Very, very sensitive in infants, and it's sensitive for a reason. It's trying to protect your infant's airway. So as your child is trying to understand, how to swallow and move food around the mouth, then the gag reflex is there to protect before food enters into anywhere near where the airway, where the trachea is. So slightly separate areas, but the point is to try and protect the airway. But the way it looks is a little bit different to coughing. Actually, before I move on to that, just to mention that the reflex point actually changes with age. So quite often, so for the person that mentioned a little while ago that the little one has a very sensitive reflex and they were gagging quite a lot, it actually the gag reflex for them, I think it was 5 months if I remember rightly, is quite far forward. So it's kind of happy back into the mouth, as opposed to for us as adults, it's back our throat. So it's actually in their mouth. So when they're maybe a certain angle of it that they're drinking at, they're stimulating the gag reflex. So it's not necessarily there's anything wrong. But of course, if it's something that's causing concern, definitely something to discuss with the GP. But generally, when a child is gagging, and particularly when they're young, it's because whatever they're drinking is just hitting that reflex point. Maybe it's worth considering, whatever whatever they're using to drink with. Could it be that the spout is just angling at a certain point, or the water's coming at a certain point that's just hitting that sensitive point? Is there maybe a different kind of implement that you could maybe use to just to play around with it and just see why is the gag reflex being stimulated? It's not necessarily there's anything wrong per se. It's just it's a natural mechanism to try and prevent somebody from choking.
Yeah, and it's worth, trying out different teats because they're all different materials as well, and some are softer than others, and just seeing, and they have different lengths too. They don't all go to the same depth. So playing around with that a little bit could be helpful, I think.
Yeah, definitely. Now, how does this look different to choking? So quite often when somebody's gagging, you'll see their eyes will water. And the classic is you'll see, just like in this picture that's shown in the slide, is their tongue is pushed forward and out of their mouth. This is very typical for somebody who is gagging. And the food, if they have any food or water in the mouth, is usually projected forward, and quite often there's retching. So you'll see the retching movement, and sometimes it can follow with vomiting. So this is just your body trying to expel, but this movement that's coming is coming from the upper part of what we call the gastrointestinal tract. So it's the upper part of the mouth, as opposed to when somebody's choking, the actual reflex is actually happening in the trachea down here. So it's two different areas that are being stimulated. Essentially, they're trying to do the same thing. They're trying to remove something from an area where it shouldn't be. But with the gag reflex, that is just an added kind of safety, extra bit of sensitivity, and to try and protect the child's airway, just to make sure that they are in control of what's happening in their mouth, and then moving food backwards and swallowing it. Just before I move on from that, did that help address the lady who's asked the question's concern, or can I elaborate on anything further?
I'm waiting for them to put it in the chat if there's anything else. Hoping that this person is still on the call. Yeah. So I guess we can assume that's okay.
Okay. So let's talk about prevention, because you can never stop a child from choking. It's a developmental process. The children will choke. We will all choke. But what can we do to prevent it? Really, really important. This coming back now to the size of your child's airway. It is so important to cut food into small pieces. So just think about the size of your child's airway and think about, how you give them food. Particularly, we're talking about food which is round. So strawberries, like in this picture, blueberries, grapes. These are all nice circular fruits. And thinking about, again, the two different types of choking. So you have the mild airway obstruction, which means that the airway is only partially blocked. That means air can get through. So just imagine a bit of strawberry, which is cut in an irregular shape or in long slices as opposed to left whole. It means that if they choke on that bit of strawberry, it's not going to fully occlude the airway. So there's still going to be air coming past that piece of strawberry. However, if you give them a circular fruit and you don't cut it long ways, then that is going to be a complete airway obstruction. So it's really important just to take a moment and think about, you must protect their airways by giving them irregular shaped pieces of food, which do not nicely fit around a tube. Reduce distractions. Now, I say this knowing as a mum, there were occasions which I'd be very glad to give my children some distraction to try and get some food into them. However, we must try and minimize that. Because if you're distracting somebody when they're eating, they're not being mindful of what's going on inside their mouth. So it's really important to try and, as much as you can and humanly possible, and keeping your sanity, to try and really make sure that your children are aware of what's going on inside of their mouth. And certainly, it's not the time for kind of too much fun and excitement, because if there's fun and excitement, and when they're trying to eat, there's a possibility that will also encourage somebody to choke. And it sounds really obvious, but keeping choking hazards out of the reach of infants. Now let's go on the next slide, maybe an area for further discussion. So let's talk about what are those choking hazards. So I mentioned a few already, but let's just kind of elaborate on these. This is not an exhaustive list. You know, there are, I'm sure, other things out there that I may have forgotten to list here. Hard or sticky sweets. Small children, small airways, that's not such a good idea. Something maybe to wait until they're a bit older. Hot dogs, meatballs or fish balls, again, because of the circular nature of the food itself. Popcorn. A lot of people think popcorn can be quite innocent, but unfortunately not so much. It can cause somebody to cough anyway, but actually the problem is if it gets lodged in the airway, it will actually swell. And that's the same with marshmallows. And that's why, you know, marshmallows, which seem very innocent and soft, if they get stuck in the airway, they can be really difficult to move. We've talked already about grapes and berries and tomatoes. Bread, sometimes bread is one that people didn't think about. So when you think about soft, doughy bread, you think that's maybe a good thing to give to a child. Again, what can happen if they choke, it then starts to swell. So saliva will be absorbed by the bread and it'll start getting bigger in size. It's very difficult for it to move. Not to say that you shouldn't give children bread, but maybe toast it and give it in strips and slices. So just be careful with particularly soft, doughy bread. Raw vegetables, just because they're hard, just think about the children that don't have those molars like we have. They're breaking up food with their gums at the back after that initial bite. But for younger children anyway. So just be mindful when you're giving them raw vegetables, and certainly think about, you know, thin strips as opposed to chunks. Fruits with skins in them. So again, it's kind of getting back to that, thinking about what's happening in the mouth, what ability do they have in their mouth to break down skins. So they can bite into a skinned piece of fruit, but then what's going to happen is when they start mushing it in the back using their gums, they're not able to tear the skin. Unlike what we can do with our molars, they cannot do that. So if they choke, that skin may be problematic and hard for them to clear in their airway. Dried foods, just be mindful of raisins. And I know raisins are a favorite to give kids as well. But if you have some raisins, they can, again, absorb food, they can swell, and they're just that kind of perfect size to slip over and swallow without chewing. And that's more the issue, is because they're just that nice size that kids can put them in the mouth and they actually don't chew them, they just go straight down. And so that's more the concern. Nuts, obviously because they're shaped in size and obviously very hard, very difficult to clear. Nut butters. So nut butters are that sticky, gooey, consistency. That again, if you give them it's more about giving spoonful. Not, you should not put nut butters on toast. It's more like giving a mouthful of a nut butter on a spoon. Then that can congeal together, and if it does get caught in the back of their throat, it can be difficult to clear. So these are the foods that can pose potential risks, and something to be given with caution. And some maybe just to wait till they're a little bit older, able to engage a little bit more in the eating and the swallowing process, and be less likely to choke.
We've got a question here.
Yeah, sure.
Up to, oh, sorry, two actually, sorry. Besides food, is there a concern of babies, toddlers picking up random items at home or at the playground and then putting it in their mouths?
Absolutely.
Big
Yeah.
hop, Mom. How do we reduce that risk, especially when we're outside of the home environment?
It just keeping an eye. You know, it's there's no kind of a quick fix to this one really. And just on that note, let's talk about those other choking hazards. So the latex balloons, one of them. So you know, latex balloons or any balloons, they're stretchy. So if a child does pick up a balloon, all nice bright colors, something you could also get outside. Then you know they can pop it into their mouth, and the problem with that is that it becomes a bit of a difficult thing to remove because it's stretchy, and it could obviously be causing some problems in and around their airway. Coins are the same. Coins are nice circular shapes, something that you can pick up quite easily from the ground, nice and sparkly. Marbles, also a hazard for outside. Button batteries. Now, this is something, and it's something we posted. I can maybe share again on our Instagram page. It's a really good example of what happens with button batteries when anyone swallows them.
Yeah.
It actually starts to burn through your tissue, and very quickly. This really, if a child or anyone has swallowed a button battery, they need to get to hospital immediately. It's a life-threatening thing.
Yeah.
Toy magnets are similar. I know my kids come back from school with these little multiple colored little magnet balls that they like to play with. And I look at them as a parent and very, very uncomfortable to have those things around.
Yeah.
So, you know, if a child swallows them, you know, and if they swallow more than one, then of course they're still going to be attracted to each other. And they can cause all sorts of terrible things to your insides. Small toys and pen lids, just a few of the examples. So sorry, I can't give an any reassuring answer. I must sound like very much negative doom and gloom here, some of the things that may happen to children, but it's really, really important that all of these things pose a danger. And it really is, while children are so young, and while they're exploring the world quite literally through their mouths, it's really important just to keep an eye on them at all times, because they're innocently just trying to understand the world. That's all they're doing.
Yeah.
And they don't unfortunately understand the dangers of what goes inside their mouths.
Absolutely. I've got two questions. One is, up to which age are these foods and items typically choking hazards?
Good question. Now, as a mum, and my children are older now, so they are 8 and 10. And I still put grapes in their lunchbox, going, "Oh, I really want to cut them." I have
Yeah.
to stop myself because you know, really, it just like the risks that I kind of set out at the beginning. It's all more to do about distractions, lack of molars, and just an experience of chewing. So really, is there an age? Or you could look at lots of different websites that will and guidance from different countries which will give you different ages. I think it's where you feel comfortable and you know your child better. And there's one of my children, I would absolutely think it's unlikely that they should become distracted. Well, unlikely, less likely than one of my youngest child who definitely gets distracted very easily. So I think that really it depends on your child, it depends on your kind of comfort level. But I would certainly say that certainly when they are 4 and under, 5 and under, if you want to be extra cautious, this is the age group which are at risk of choking statistically.
Mm.
So once they kind of pass that age 4 or 5, then they're less likely to have these issues. But maybe when they're 3, 4, 5, these are things that maybe with your supervision and making sure that they're not running around distracted, that there's less of a risk. It really depends on the environment. And certainly, what I sometimes I see, and I probably am a little bit more sensitive than most to this, but when I see children running around playgrounds with handfuls of grapes, this is just a recipe for potential disaster. So,
To be honest, for me, eating on the playground or while running around is a total no-go. There's so
yeah,
much potential for
yeah,
accidents. There's
yeah.
one question too that a mom had on gagging. My child gags when I'm brushing, cleaning his tongue, but I persist. Should I stop doing this?
I mean, I think that depends on. I guess there's two ways to look at that. Um, you're cleaning the tongue and that kind of that dental hygiene and that practice that you're performing, if that's something that you feel is important, you want to do, then the gag reflex is just purely because you're stimulating, you're touching. You're not doing any harm. It's just a natural process because you've stimulated exactly where where the gag reflex is to move something forward in their mouth. So you're not doing any harm. I think that if you want to do that as part of their dental hygiene, there's no harm in doing it. The gag reflex is just a normal response. You're not doing any harm in that process.
Okay. Do magnetiles fall under toy magnets?
Ooh. Well, it's funny. My kids had magnetiles, and still I have a few, I think, around the house. But I have seen a few articles recently around magnetiles, and not in a positive bit of frame. But I think a lot of the issue sometimes with the magnetiles is when they are older magnetiles, or when they're actually not true magnetiles, and they're maybe of a poorer quality. Then those little magnets do actually become dislodged from the plastic. So then there's a risk, yes. So the magnetile themselves, as long as it's not broken, and there's no risk of that magnet coming out, it is not a problem. It is, when maybe they're a bit older, and maybe if there are, I don't know, copies potentially, as we find quite a few of them around, then there's a more of a possibility of that magnet becoming loose.
Yeah. Speaking of copies, do you want to talk quickly about the suction devices that they are?
Let me just mention that quickly. Nobody's asked the question, but it's a common question that we face in these talks. And people often say, I have a suction device at home. So should that be something that I would use instead of some of the first aid measures that we've shown you in this talk? So for those of you that maybe are not familiar what a suction device is for choking, there are these devices which look like a face mask you put over someone's face, and there's almost like a plunger at the other side. So you pull it back and you cause suction. And the idea is to bring whatever that is in the airway out. So LifeVac is one of the more famous ones, which is available on the market. Now, if you look at the guidelines, the country-specific guidelines, certainly the UK and the US, they will say that these are not devices that should be used as a first-line first aid measure. Now, the reason for that, there's two reasons. The first is some of the research related to these devices does not meet the standards that some countries would like. Now, in saying that, LifeVac, I believe it's LifeVac, have more robust research. There's another brand on the market, the name I forget. There's the two of them, one has more robust research than the other. So they have a use, and there are similar like devices that are used in hospitals. So it's not that they're not useful, it's just that they shouldn't replace first aid. Because if you're relying on this device, you would want to hope that you have that device with you if you ever come across a choking incident, because you may not. It's something that's probably going to be sitting at home. And then maybe you can't find it in that moment of panic. And these devices have different size masks as well. So at least 3 different masks you have with them. You need to get the right mask for the right size. So if you can imagine you have a few minutes to help clear someone's airway, that time is quite precious, and it maybe isn't best served trying to find the LifeVac, getting the right mask onto it, and then starting to use it, which I think is why most countries say that what we've talked about in this talk should be your first line. Now, however, if you have a LifeVac in your house and you've tried everything else and it's not working, by all means, give it a go. So it's not that don't use it. It's more about, it has its place. And if you do wish to have one of these, make sure you get the original one. This is not something to invest on a cheaper copy that you may get on online sites. Because, of course, there's robust measures to test these devices to make sure that they're safe. Okay.
Yeah, amazing. Thank you for mentioning that.
Any other questions which I haven't addressed?
Are we at the end of the presentation, or?
Hang on. Yes.
Perfect. Do you want to stop sharing now and show us your lovely face again?
Yeah, I can do. Well, before I do that, let me just do a couple more things because there might
Oh,
be
yeah,
some
sorry.
things that people might want to do. No, it's okay.
Oh, great.
But just very quickly, just to mention that we do the courses for helpers and courses for parents every month in different locations. One location is the Funan Mall, the other one is an East Coast Road. And this Saturday we have a course for parents, and the following Saturday we have for helpers. Just as you mentioned, Joanna, earlier, that we can do private classes in your home. And if you are able to get a group of 5 people together, then you can access a discount as well, which is just to Bumpwise clients. And of course, we do first aid certification courses. So if you want to get to our website, you can scan that QR code or just look us up later at firstaidtuition.com.sg. Now, the other thing I wanted to share with you as well is we have a first aid kit list. So we try and help parents. We try and people often say to us, in our courses, what should be in my first aid kit? I'm not sure. So what we did is we actually created one. So we went out to Guardian and other such places and took lots of pictures of things, and then we made our own first aid kit. So you don't have to buy the ones online, and you can actually make your own up, and it usually ends up being a little bit cheaper. So you can scan the QR code and you'll access our first aid kit list. And just to add on to that, some clients have said to us, I don't want to make my own. Can you just give me one? So we're working on that. So if you are interested in buying a first aid kit, which we will create, it's something that we're working on. So if you follow us on Instagram, you may well find out a bit more about that as time comes. So I will stop sharing that.
Maggie, I've just tried to follow that link, and it actually says to subscribe to get access to the newsletter rather than.
So that's the wording is wrong. Sorry. And what that is, once you subscribe, maybe we should probably change that wording. What will happen is the next window it will pop up. It will actually be the first aid kit list.
Oh,
it
I
should
see.
be. I did check it last night and it did work. It did come up with a first aid kit list.
Great. I'll just share that with the recording as well later.
Yeah, and if you, it just for full disclosure, you do then go into our mailing list, which hopefully is something which you'd find useful. Every month we release a blog on various topics. So, last month was how to handle burns, and this month we're talking about poisons. So,
Yeah.
And you can of course unsubscribe at any time. We don't force you to receive our emails.
But that's amazing. I mean, that's really good knowledge for everyone to have. I mean, once a month is not spamming anyone. So I think really useful content that you're sharing there.
Yeah, we try to. And also we try and do the same thing on Instagram. So if you're more of an Instagram person, then we do snippets from the blogs on Instagram. So that'd be easier for you to snippets of information rather than having to read too long an email.
Amazing. Any other questions, parents? Have we got something else in there? Let me just see if I missed anything. No, I think I've got them all. Okay. Well, if there are no questions, and if you have questions later, and also for those of you who are watching the recording, maybe if you've got a burning question, you can always get in touch with them on Instagram as well. Send them a little message, send me a message, I'll forward it to Maggie. Somehow we'll get your questions answered. And yeah, so thankful for you, Maggie, to have spent your afternoon with us. I know you have to rush and pick up your kids.
Yes,
so
kids run there.
I won't keep you any longer. Thank you, parents, for joining us as well. And I hope you all enjoyed it as much as I did. And we'll see you soon. Okay.
All right. Thank you very much, everyone.
Bye.